Talk about this new surge in cases of COVID-19. Everybody is worried. Are we going to see the same situation we saw a couple of months ago when the pandemic started?
Well, it's always difficult to predict what will happen with a surge, but we do think that if the current trend continues, that we could have 2 to 3 times as many COVID hospitalizations as well as cases this time next month. The surge this time will probably be a little bit different than the last time, and there are many things that have changed. First of all, we are better prepared. We now have safety protocols all written out. Our staff are accustomed to taking care of COVID patients. We have a good supply of personal protective equipment, and we think we do a better job taking care of COVID patients. However, on the other hand, what may be going against us is we may have some fatigue from the community, and we're all getting tired, and so recent surveys show that although most people feel like things are getting worse with COVID, that in fact many people are not taking the degree of precaution that we would hope in terms of distancing or masking or avoiding gatherings.
What were some of the biggest things that you learned from the last go-round here when the surge occurred the last time? What were the lessons learned that are going to help you now? Yeah,
so in addition to creating a lot of the protocols, learning how to quickly sort of trade off space. So for instance, in preparation for what we're seeing right now, we've actually changed some of our regular units into COVID units. In addition to sort of thinking ahead in terms of about things like staffing, what we've also learned is that we have to be very careful with the balance of having restrictions versus maintaining access for patients. And if you recall, when the pandemic first started, people were afraid to come to the hospital, and we stopped elective procedures. We stopped a lot of types of regular care, and that allowed us to be ready for a potential surge. However, if you do that too far in advance, or you overextend that, then you may end up with empty hospitals, and you may end up with patients who actually need care who are not coming in. So we know that balance is very important. So this time around, we're trying to make sure that we maintain all of the regular access for care that patients need, whether it's in person or by phone or by video.
So tell us, one thing that I've talked to Dr. Kaiser, our public health officer. He has mentioned that while there might be more hospitalizations, more ICU cases, he's hoping that the number of deaths that occurred related to COVID may be going down. Why would that be?
Yeah, so that's absolutely true. While we do not have a cure for COVID right now, we have learned that there are certain treatments that can help someone get out of the hospital faster, that can sort of improve our recovery rates. So taking all of those precautions, figuring out how to position patients when it's appropriate to give supplemental oxygen, all of these things help us we believe, in probably providing safer care for patients.
And we see some amazing stories, worldwide, of patients who are considered elder and at risk. People in their 80s, 90s who came out, successful after being, with COVID-19 hospitalized. What will you say is the key to say, hey, we can actually save lives, senior citizens' lives when they have COVID?
Yeah. So we do know that many people get better with COVID, but unfortunately, it's still very difficult for us to predict. So the best scenario is still to take all the preventive measures possible and make sure that we're minimizing our risk, not only to ourselves and our families, but especially to the vulnerable and elderly individuals, in our social circles.